My name is Dr. Phillip Rabito. I'm 43 years old and I am an endocrinologist.
Dr. Rabito, for people who don't know, and I think there are a lot of them, what exactly is an endocrinologist?
An endocrinologist is a doctor that's trained in internal medicine that has a specialty that focuses on different hormonal problems, and the bulk of those problems are thyroid and diabetes.
So we get the big D in here.
That's correct.
Now, diabetes seems to be one of these things that we hear about more and more these days. How many people actually in this country have it?
Diabetes is becoming more and more prevalent. It's actually 26 million people have diabetes, and that just came out from a recent CDC report. 26 million people, Americans, have diabetes, and that's completely correlated with the increase in obesity of recent. And 79 million people have prediabetes, which is the condition that leads up to diabetes. So this is a growing epidemic.
So that's almost a third of our country.
Basically. 11% of the adult population has type 2 diabetes.
So this is bigger than cancer and all sorts of things.
Yes, it is.
Talk to me about some of the risk factors and what, let's talk about the risk factors and then what you do to help people and how we can prevent this. Because it's, I don't think people, I mean, I personally, even though I have a family full of diabetics, I don't exactly know all this.
Right. So the risk factors for getting diabetes, the people who are at risk for developing type 2 diabetes are those who have genetic propensity, the people who have first-degree relatives who have had diabetes in the family, okay? So this is a brother, mother, sister, father in the family. Oh.
You're looking at one. No, but you're looking at one. My mother has it. My grandmother has it. Everyone in our family has it. This is why I'm talking to this guy. Okay, back to you. So really that's...
So genetics you cannot change, but your lifestyle you can change. So people who have obesity or overweight are at increased risk of having diabetes also.
Can skinny people get it?
They can, but it's more rare. Insulin resistance is more associated with people who are overweight or obese.
So someone comes in here to you and they're obese. They just assume they have diabetes. How does it work? How does someone know they have it? How does someone get here? What's the journey from the street to this office to health?
Right. So basically, diabetes has positive symptoms. Most people don't have any symptoms from diabetes. When you have symptoms, then your diabetes is far along in advance and your sugars are very high. And those symptoms can be excessive urination, weight loss, blurred vision, okay, and excessive hunger. Most people do not have symptoms, as I mentioned. So I think what you have to do is, if you have risk factors for diabetes, and again, I'll talk to you about those risk factors. They are genetics, family history of diabetes, obesity or being overweight, being of certain ethnic backgrounds, Hispanic, Asian, African American, and American Indian. Also having a history of gestational diabetes, which is diabetes in the pregnant state. These are all risk factors for type 2 diabetes. These are patients that should go see their doctor and ask for a screening test for diabetes, which is a simple blood test that's done in the morning. There's two actual tests. One is a fasting blood glucose, and the other one is a hemoglobin A1C, which is now, as of in the last year, a screening test for the diagnosis of diabetes.
Is there an age correlation here? I mean, is it after a certain age that tendency goes up?
There is an age correlation. As we get older, our body morphologies change. We have less muscle, we have less lean body mass, we have increase in fat. With that comes increase in insulin resistance, and the incidence of diabetes increases with age. So most people over the age of 45 who have at least one of the risk factors for diabetes that I mentioned should be screened for diabetes.
Every year?
If you're screened and you're negative, the ADA recommends that the next time you should be screened is within the next 3 years.
Oh, that's cool. Phew, I missed out. So you just mentioned something, you said a word in there that seemed like it jumped out and grabbed me. You said body mass, muscle. Mm-hmm. That would, to me, say exercise.
Absolutely.
Talk about that.
So exercise and lifestyle modifications, changing your lifestyle and changing the nature of the foods that you eat, and changing your body shape play a huge role in who's going to develop diabetes and who's not going to develop diabetes. As I mentioned, you cannot change your genetics, but you can change your body shape and your lifestyle. So people who adopt lifestyles that are more active, exercising 30 minutes a day, cardiovascular exercise, and changing the nature of their diets, reducing their intake of fats and increasing their fiber intake and reducing their overall caloric intake, has a dramatic reduction in the chances of them getting diabetes later on in life.
And what do you do? Do you send them to a nutritionist? Do you what like all right, I'm gonna just put a play like just sort of person here. I come in, I'm 65 pounds overweight. You diagnosed me with type 2 diabetes, and because I know a lot of people with diabetes actually who don't actually change their lifestyle. What do you do to me now? What do you say to me now? How do you take me by the hand and lead me through this labyrinth of how I get better or how I control this disease?
Well, I mean, I have a background in nutrition support, and I have a particular interest in nutrition. I think nutrition, you know, obviously you have to have a good knowledge and background in nutrition to be able to adequately treat a diabetic patient. So what I would do is go through your whole diet, and I would, you know, basically ask you to bring in a 72-hour food diary, and I would look at all the different things in your diet, and I would try to give you different food substitutions. And a lot of people are eating things that they think are healthy that are not necessarily healthy. It may be high in sugar or maybe high in fat. Okay, so I'll make small substitutions, and what I like to do is give people a tailored exercise program according to their lifestyles, and try to give them an incremental exercise program that they can adopt into their lifestyle. So the two things go together. So your body shape and the amount of fat you have in your body are a function of two things. One of those things is your caloric intake, how many calories you take in, and the nature of the foods that you eat. And the second thing is how much you expend as far as exercise. You need to increase one, obviously the exercise, and reduce the other, and that is the food intake, to be able to maintain, to increase your weight loss and also maintain that and reduce your risk.
I've heard that like if the more muscle burns up more fat than like the more muscle you have, the more that you all day long burn up fat. Is that true?
This is true. So the more muscle you have on you, so weight training does play a role. The more weight that you have on you, you increase your basal metabolic rate, and then you're burning calories sitting on the couch. Okay? Now you have to have a significant amount of muscle to be able to increase your basal metabolic rate significantly. Okay? So cardiovascular exercise, and that's running, treadmill, jogging, swimming, cross-country skiing, all have to play a role in your weight loss. But weight training should play a role also, because increasing your muscle mass does increase your basal energy expenditure and allows you to increase your burning calories even at rest. So it's a combination of the two, but I would say that we should stress, and the ADA agrees with this, that you should stress exercise over weightlifting and resistance training.
So, because people think I'm the exercise Nazi, so you would tell all your patients, just as a matter of course, at any age that they've got to start exercising? Well,
first of all, it depends on their risk. I mean, if you're diabetic and you have hypertension and multiple risk factors for cardiovascular disease, I would want to do a very good history and make sure that I'm not putting you on an intense exercise program that might lead to a cardiac event. So I want to make sure that you're cleared from a cardiology vantage point. And then I would tailor an exercise program according to your particular needs.
And you do that and what if people don't follow it? Then what happens?
Well, I mean, this is a common thing. I mean, I think, you know, not everyone's so truthful when they come back after a visit, but you basically have to keep on pounding the table and explain to people how important it is, because actually even one exercise event, so your glucose goes down after one exercise event, and your blood vessels are actually improved after one exercise event. So I try to stress the importance of exercise above and beyond just the obvious weight loss, that there are effects above and beyond that.
So if you could give people 3 bits of advice, just, you know, going forth, I mean, because it just seems like diabetes has taken over. I mean, I don't remember this one from when I was young, that so many people had it. What do you attribute that to? The laziness of America? Because people seem to be, there's more gyms now, people know.
This is true.
I mean, like McDonald's puts the calories up there, that the burgers are like 500 million calories. Why is there such an increase?
Well, I think, and again, this is part and parcel with the increase in diabetes is part and parcel with the increase in obesity. Okay, so I think what we're seeing here is a lifestyle in which we're more sedentary. The kids are more likely to be on video games than they are to be out running in the streets and playing. So you have people that are generally more sedentary than they were, and the diets have changed. You have the advent of a lot of fast foods that provide a low-cost, high-carbohydrate, high-fat, delicious foods that really are very easy and inexpensive and affordable to the masses. So I think this is just perpetuating it. So I think what I could recommend is really focusing on a good diet. And unfortunately, not a whole lot of people understand what a proper diet is. And a lot of people are eating things that they think are healthy that aren't necessarily healthy.
So just because something says low fat, low sugar in the market and it's made by Nabisco doesn't really mean...
Exactly. In fact, if it says low fat, then it's probably high in sugar because they have to make it palatable some way and make you come back for more.
Okay, let's just kind of scare the shit out of people here. What are really... People don't... What are the side effects? I mean, what is... when you have diabetes, what are you at risk for? Because I don't think people get that at all. So...
Right.
Let's just give them the 1-2 punch here at the end.
Right.
What do you...
So people think about diabetes and they don't really understand what... I think everyone kind of correlates diabetes with cardiovascular disease, heart attacks. But see, diabetes affects blood vessels. It affects large blood vessels and it affects small blood vessels. So all the organs in the body that are extremely vascular, that have a lot of blood vessels, are affected. So it's the #1 cause of blindness. It's one of the leading causes of hemodialysis and renal failure. It's one of the leading causes of non-traumatic amputations. It's one of the leading causes of impotence in men. It causes neuropathy, painful neuropathy, okay? And there's a whole host of other things that can happen to diabetes, so diabetic patients, especially when they're poorly controlled. So when a patient has diabetes, it's important to control their sugars to get them under control, to reduce the risk of all those vascular events. But it's also important to control all of the other associated risk factors for cardiovascular disease, their blood pressure, their cholesterol, and other issues, other comorbidities associated with the disease.
So diabetes that goes untreated or diabetes that gets really too far, what's the linkage to that and death from... I mean, how many people actually die from something related to their diabetes?
Okay, so the death from diabetes is a very big number. I don't have that number offhand, but if you have type 2 diabetes, then your risk of dying of cardiovascular is 4 times as likely as someone who does not have diabetes. So it's a dramatic number, okay? And then stroke obviously is significant, 2 to 3 times their increased risk, and all these other aforementioned conditions are increased with diabetes, and they're correlated. Some of them with how well the diabetes is controlled, how well the sugars are controlled.
Whoa, well that's a lot of information. Doctor, thank you very much. And any of you who have any of the risk factors that Dr. Rabito mentioned today, how do you find an endocrinologist? What do? You go to Yellow Pages, go eat? I mean,
yeah, I mean, you can go to the American Diabetes Association or the American Association of Clinical Endocrinologists web pages, and you could just look up locally your local endocrinologist or ask your local internist for an endocrinologist. But I think, and it's been shown, that patients who have diabetes generally do better when they're followed by an endocrinologist, but a small percentage of patients with diabetes are actually followed by an endocrinologist.
Well, thank you very much, and hopefully those of you out there who are at risk will go find yourself one.